settle as quickly as possible, that would be fantastic. There's always one. All right, welcome back. So we've got the second half of our summit about to start, looking at the question of alcohol, obviously a vexed issue in our community. Everyone, please keep using the Slido app to get your questions up there. I think it's working well. Remember to upvote the questions that you see that you think really are worthy of attention and bring them to the forefront for the moderators. That'd be great. All right, well, it's my pleasure to welcome Nadia Mitsopoulos, who's a fantastic journalist and a wonderful interviewer with the ABC. Nadia, the floor is yours.
Thank you very much, Griffin. Good afternoon, and it is lovely to be a part of this afternoon. As Griffith's mentioned, of course, we turn our attention to alcohol, and I'm sure you would all agree there is plenty to talk about in that space. Well, in this plenary session, you will be hearing from Professor Steve Allsop before we then move to our panel discussion. Now, Steve Allsop would be well known to you all. He is a professor and past director of the National Drug Research Institute at Curtin University. He is a previous director of the National Centre for Education and Training on Addiction with Adelaide's Flinders University, and he's also held senior positions at the West Australian Government Drug and Alcohol Office. Steve has chaired national expert groups on responses to alcohol and coexisting mental health and drug problems, and is widely respected for his extensive knowledge and experience in the drug and alcohol sector. Something you may not also know about Steve is that he is a recovering publican. Yes, believe it or not, Steve actually ran and part-owned a pub in Scotland, and I suspect that may fuel his thirst and passion for this topic. I have spent many years interviewing Steve Allsop, but it was during an interview I did with him a couple of weeks ago that he said something that resonated not only with me, but certainly the people that were listening to our conversation, and he said, "Treat alcohol with the respect it deserves." Please make welcome Professor Steve Allsop.
Thanks, Nadia. And if you wonder where in Scotland it was in a tiny place that none of you would know, but it was fondly referred to as Allowen Nil, which went to the skills of the local football team. So, first, I do respect the land on which we stand and the elders who've looked after this land in the past and currently and will do so in the future, without which we wouldn't be standing and living in such a wonderful place. And I do that not just because it is respectful to acknowledge the traditional custodians of the land, but it also reminds us that connectedness to school, connectedness to community, and connectedness to culture are important preventives in terms of mental health and alcohol and drug problems. So I make that acknowledgement in that sense, not just in relation to respect. I also want to dedicate this to the young people who might have been injured in a car crash because somebody who drank too much drove their car into them. I want to dedicate this to the people who go out for a night out on a Friday night and end up in hospital or dead because of somebody who was intoxicated hitting them. I dedicate this to the people whose families are disrupted by alcohol. And I think it's important to do that because often we get enmeshed in the data, which is critically important, but we forget the individual faces, the individual lives, and the whole community who are affected by alcohol, and I'll come back to that point in a minute. Now, some of you will realise the limited repertoire I have if you've seen me before, because I always start off my presentation with this quote, but because I work in this area, a lot of people say, on the rare occasions when my wife and I are invited out to drink, they say, go out for a meal rather, they say, does he drink, on the assumption that they're going to have to get the orange juice and the water out, sugar-free orange juice. And so I like to clear up my views about alcohol at the beginning because it's important, my personal perspective. But rather than use my own words, I'm going to use the words of a politician because, as we know, politicians are usually unambiguous and straight to the point and don't compromise. And I'm glad the minister's not in here. And this particular American senator, when he was asked about what used to be my national drink, whiskey, he summed up pretty well what I think. He said, well, If when you say whiskey you mean the poison scourge, the bloody monster that defiles innocence, yea, literally takes the bread from the mouths of little children. If you mean the evil drink that topples a Christian man and woman from the pinnacles of righteous, gracious living into the bottomless pit of degradation and despair and helplessness and hopelessness, then I am in favour of it. I am against it. Whoops. Well, if he was Donald Trump, that's what he'd have said. But if when you say whiskey you mean the oil of conversation, the philosophic wine, the stuff that is consumed when good fellows get together, that puts a song in their hearts and laughter in their lips and the warm glow of contentment in their eyes, if you mean Christmas cheer, if you mean the drink that puts a spring in the old gentleman's step on a frosty morning, a drink that enables a man to magnify his joy and his happiness and to forget, if only for a little while, life's great tragedies and heartbreaks and sorrows. If you mean that drink, the sale of which pours into our treasuries untold millions of dollars, which are used to provide tender care for our crippled, aged and infirm and to build highways, schools and hospitals, then I am in favour at this time. I will not compromise. I will not retreat from this. And he sums up really well the challenge that we have with a drug such as alcohol. That there are those who see the harms, and there are those who enjoy the conviviality, and it seems that one gets pitted against the other. So my job is to talk about alcohol and alcohol problems and talk a little bit about some of the evidence, and then others will talk in more detail about this. But the ways in which we conceptualize alcohol affects how we respond to alcohol. So a little exercise, imagine putting your hand up. Don't put your hand up, remember you're on television. I'm going to ask you to imagine whether you'd put your hand up to this. Now I do caution this because once I was in a small village and the local GP put his hand up. And I would ask you to think how you would answer the question if I said, do you abuse alcohol? And I think very few people would even consider putting their hands up. But if I said to you, don't put your hands up. If I said to you, how many of you at some point in your life have maybe driven your car when you shouldn't have? How many of you have been late for work or performed not as well as you should have at work because of the drinking the night before? Argued with your partner, argued with your parents, told a joke you later regretted. And the one that seems to get the biggest response, or ended up in a relationship you might not otherwise have ended up in. And when you say that, you can see people saying, yeah, I've done that, that's happened to me. And unfortunately, we define alcohol and adverse consequences of drinking as being something that happens to those people, heavy drinkers, which means somebody who drinks more than me, people who abuse alcohol. Well, the only way to abuse alcohol is to wash your car with it. It was meant to be drunk. And yet the language we use creates an image that it's about a few people who we should be concerned about, and it's about individual responsibility, and yet we should support treatment. And it's not about what all of us in the community might do, that all of us who drink at some point may have some adverse outcome from drinking. It might be once, it might be one or two times, but as a sum total, that has impact on the whole community. And just to give an illustration for that, if we targeted our responses to drink driving to people who are alcohol dependent, we wouldn't get most of the people who are actually getting into trouble with drink driving, causing havoc for themselves and other people. So how we conceptualize and how we approach alcohol problems is critically important. Anthony Thorley, who is sometimes bemused by the impact his model has had, designed a very simple model of alcohol problems that helps us think, because there isn't an alcohol problem, there's a whole range. There are problems to do with drunkenness. And if you asked a lot of people what concerned them about alcohol, it's actually these problems: drink driving, violence, being woken up at night, not feeling safe down in Northbridge, all of these sorts of things. Anyone who drinks can have problems with intoxication. I may never have consumed alcohol before, and tonight I go out and have 12 beers, and any number of severe consequences could happen to me or someone else. I'm not alcohol dependent, I'm not an alcoholic, I'm not a regular heavy drinker, just because of that drinking on that occasion. And there are also problems to do with the drip of alcohol. I have a couple of beers on my way home from work, after 5 minutes quality time with my children, if they're on a good day. I might have a drink before dinner, and I might have a glass of wine with dinner. I might have a nip of whiskey before I go to bed if my name was Mike Daub and I've got the money to pay for the best whiskey. Everybody else is having a go at him, so I might as well. And so I might not ever become intoxicated and experience problems of intoxication, but if I drink in that way, a number of severe consequences could arise in relation to health, maybe my economic circumstances. So there are people who might have problems in both areas, but to give illustration, it has changed a little bit, but in my original country, if you compared the Scots to the English, let's say they both drank 21 beers in a week, the Englishman would drink, or the Englishwoman would drink 3 beers on Monday and 3 beers on Tuesday and 3 beers on Wednesday, whereas the Scot would drink the 21 beers on Friday night. So you don't see livers rotting quietly away in Surrey, but you see the drunken Scots running down the street at you on Sauchiehall Street. Or the other issue, we're all told that we should drink in the sophisticated way that the French do, often by the French. And we've heard this myth recently that if we drank like the Southern Europeans. Well, if we drank like the Southern Europeans, we'd probably have 2 to 3 or 4 times the rate of alcoholic cirrhosis. Drunkenness is frowned upon. They called it the Anglo-Celtic disease because they would. But it does occur. Just because you might not have observed it when you went to a tourist area, and I've seen evidence from government officials in Spain that their rates of alcohol intoxication problems, heavy episodic drinking amongst young people mirrors what's happening in Australia. They still call it the Anglo-Celtic disease. So, first point. Different patterns of alcohol use result in different sorts of harms. And having small bars doesn't make us all speak French. And if we have more and more outlets and more consumption like France, we'll end up with similar levels of alcohol-related harm. And if you want evidence of that, look at what's happened in the United Kingdom when they liberalised the laws to emulate what was happening in the mainland Europe. So, key point, if you forget everything else, you can drink. Oh, I've got a pointer, haven't I? You can drink like the French and kill yourself, or you can drink like the Scots and kill your neighbours. And then there are problems to do with dependence. Now, if you talk to a lot of people about alcohol If you talk to a lot of people about alcohol problems, they think we're talking about those people in the middle. They're people with alcohol dependence, who've got problems of intoxication. They're the sort of people you find in alcohol treatment services. But they are not the only people who experience harm. Now, if we work on the basis that that is what we're going to focus on, then we're not going to get effective responses. Alcohol problems resonate for all of us, whether we drink or not. So I need to get moving on. So the rationale for controlling availability is that alcohol is a commodity with the potential for harm. I would go so far as to say, if you were a free marketeer, the only rationale for liquor licensing laws is the social and health impacts. We don't regulate other products in that way. We have that regulation primarily because of the social and health impacts on alcohol. And without that, why do we have liquor licensing legislation at all? And the other point is, even if you really do believe that individual responsibility is the issue, and it'd be great if it was, I've not seen it demonstrated that it makes a particular difference to the harm that people experience, it's not just the drinkers who are affected. I remember in a debate in a very large room, a mayor was with me debating, and I said I would bring back the hours of sale in Northbridge. And she says, oh, people like you, Steve, want to affect the enjoyment of the majority of people because of the behaviour of a few. And I think there were about 3,000 people in the room. And I said, how many people here are in Northbridge at 3 in the morning? Not one of them. But every single one of them is paying for that through the impact on our emergency departments, the impact on our policing, the impact on our car insurance, the impact on the safety of our children when they go out there, and the impact on our enjoyment when we go out there. So we need to reverse the argument that this is something that resonates for all of us. It's not just a few odd or sick or bad people. The challenge for us is that the responses can be messy. There's lots of different departments and interests. So there's lots of government departments. What the Australian government decides resonates at the local government level. We've got vested interests, and there's nothing wrong with them having vested interests. I don't have a problem with that, and it's the same as for me, as Jane said this morning. I don't get invited to sit on your boards. Don't feel that you should be sat at the table with public health expertise talking about public health. Let's not pretend that you are public health experts. You are not. You are experts in the marketing of, and you're responsible to, your shareholders. So your interests do not coincide in the main with the interests of public health. So we need to work through that. And then there are decisions about what strategies people embrace, are often influenced by politics, ideology, and the perceptions that people have about alcohol and alcohol-related problems. So the evidence is consistent. It's a bit like what do you do about getting a good investment in a house? Location, location, location. Well, it's the same answer. Availability, availability, availability. Simple as that. And price, tax, the evidence is consistent internationally, nationally, over time, that price makes a difference. And then we hear arguments, oh, it won't affect young people. Well, young people are responsive to price. It won't affect heavy drinkers. Heavy drinkers are responsive to price. Sometimes they're more responsive because they're spending so much of their money on it. Price makes a difference. We also know that physical availability makes a difference. The hours of sale, the number of outlets, how many days those outlets are open, the nature of the product being sold. And I'll talk about, for example, controls on bulk packaged liquor later on. And we know that even small changes in price can make a difference. So work that Tanya was headed looking at a 5-cent increase in the price of a standard drink made a difference to the number of harms that existed in the Northern Territory. So small changes make huge public health impacts. And that's important for us to get across, because I know when I talk about price, people glaze over and think he's going to charge me $42 for my pint of Guinness. It's not. Even small changes make a difference. The drinking context makes a difference too. We'll all know bars, and we'd say, I wouldn't go there, at this bar or this nightclub or this hotel. So there's a difference in how they're managed, where they're located, what the reputation is, and how they're run. But it's not about just training people, because the evidence says training people doesn't make a difference. It's holding people accountable to the training. So it's about enforcement. And it's also about things like drink driving. And Australia has done an exceptional job in relation to reducing problems related to drink driving. Decreases in deaths of young people related to alcohol are in substantial part, I think, to do with drink driving legislation. We haven't won that, but we've made a significant impact. We know that alcohol promotions are relevant. We keep getting told by the industry it doesn't make any difference. Well, why would you do it? But the main issue is that they talk, often those studies are on the whole population, but when you segment the population, which is what advertisers do, young people are particularly sensitive to the impact of alcohol promotions. So telling a 45-year-old who's been drinking VB all their life that Chardonnay is really nice might not have impact. But 15, 16, 17, 18-year-olds, more likely to have positive views about alcohol, more likely to have intentions to drink, and some evidence that they're more likely to drink and drink heavily. And we shouldn't have young people exposed to alcohol promotions. There's agreement in the community. The government agrees on it, except, I'm talking about the federal government now, the government agrees on it, except when there's a sport on the television. Except when you go to Woolies, as some of us heard the other day, and buy some groceries, and on the back of it there are alcohol promotions, except when you get promotions pushed through to you on your iPhone or your Galaxy if you've got one of those. So young people shouldn't be exposed to alcohol promotions because it has a negative impact on them and the broader community. And the evidence in the alcohol area about education and persuasion is limited, but that's because, with the exception of drink driving, we haven't had enduring, well-resourced community information that's linked to policy and other actions. And that's why I think, to a large extent, if you ask the community what they support the things that don't work, and if you ask them about what they don't support, it's the things that do work. And I think if we want to do something in terms of education persuasion, helping people become informed. And there is evidence about the impact of early intervention and treatment, but unfortunately, there's not a lot of uptake about that. For example, there are some excellent pharmacotherapies that are available, but they're hardly ever used amongst our medical practitioners. So we need to do better in that domain. And there are strategies in relation to harm reduction, glass control, school leavers, thiamine, fortified flour. But at the end of the day, location, 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 availability, availability, availability. Does it make a difference? Well, let's just pick violence. A lot of you are familiar with the Newcastle study, but a well-controlled study where they closed a couple of hours earlier than they used to close. 3 in the morning isn't prohibitive. They closed at 3 in the morning. And they compared it to somewhere very nearby. And what they found, there were other aspects, but I think the evidence suggests it was actually the reduced availability after 3 a.m. And we saw a 37% reduction in alcohol-related, violence in that area, where there's no change in a place just up the road. And there was no displacement, therefore, no evidence of displacement. And those impacts endure. And there are similar impacts in other countries. Small changes can reduce violence in our community now. And arguing about is it personal responsibility or not, when there's no evidence that makes the difference, a difference like this. And it's not prohibitive. If we look at Halls Creek and Fitzroy Crossing, where there were reductions in the availability of alcohol packaged liquor, and we saw massive changes that endured PR1 and PR2 at 2 time periods after. These halving of police activity in relation to alcohol, assaults reduced by an enormous amount, drink driving fell, and there was also an increase, if I recollect correctly, there was an increase in the number of people who started applying to get licenses because they'd got their lives back together. There was a massive reduction in ED admissions. If we want to save money in our emergency departments, let's reduce the alcohol carnage that we see. And the sobering up shelter, it wasn't needed anymore, and the resources were invested into outpatient care in the communities. Point to make there, an intervention led by Aboriginal leaders in that community had benefit across the whole community, and the evidence tells us it endured. Should you be doing other things? Yeah, sure, you must. You must improve recreational opportunities, you must improve employment opportunities, but you don't get a look-in if a society is awash with alcohol. So it's a drug that has adverse consequences. That's why we should treat it with more respect, not just for the drinker, but for all of us here. Your car insurance is affected by how many people are drink driving. So even at that level. And so it's about balancing public health and personal enjoyment, and the strongest evidence and the most consistent evidence is about availability. And that isn't about being prohibitive, it's about balance. And I've already touched that point. So what do we need to do next? Well, we do need, and other people, I'm going to go through these quickly because others on the panel will touch on these. We need quality current data that actually tell us what's going on. And sales data, for which there's often resistance, is by far the best source of data that you can have. How much alcohol is being sold in what community, and correlate that with the harm in that community, and you have evidence-informed liquor licensing. Not having people come in and say, oh, I think this and I think that, and there's no evidence that it's going to make a difference, and there is. We also need to assess, obviously, the adverse impacts. We need to look at the issue of availability, and there's a national issue of taxation policy where we have sensible policy that affects alcohol price, and that's going to take a while, but I think we keep at that. But in the meantime, there's a real opportunity to introduce minimum floor pricing, and we've heard that that's an interest in this state. And some of the greatest harm comes from the cheapest alcohol. And we've just seen the Northern Territory go down this path. And if you had $1 or $1.50 as a minimum price for a standard drink, that will make no difference. If you go and have a pint in the pub, it makes no difference. If you go and buy a $10 bottle of wine, it will make no difference. But if you drink a carton of a cask wine, it's going to make a significant difference, because 31 cents a standard drink is far, far, far too cheap, and some of the cheapest alcohol contributes to some of the greatest harm in our community. So we can make a difference straight away with minimum floor price, but it's also about keeping the effort on the price and the taxation policy, and it's also about decisions about hours of sale, outlet density, and so on, need to be based on quality evidence. But we also need to ensure, I'll come back to another point that'll follow on from that. Minimum legal age. The evidence is clear, compelling, consistent from Australia, from New Zealand, from the United States, where they brought the age down, then they put it back up. Increasing the minimum legal drinking age will reduce alcohol problems amongst young people. The evidence is clear and consistent. Whether it's likely to happen in a country where we have voting at 18, so I accept compulsory voting at 18, whether it's a realistic target. But at the very least, we should be enforcing the laws that we have about not serving alcohol to underage people, at the very least. And lots of people in the industry do the right thing, but those who don't should be held to account. And one illustration, as someone I know was telling me about a bottle shop where they were serving alcohol to underage young women, and I spoke to the man, and he said, well, you know what they're like, they put on makeup and they don't look 18. And I said, the fact that they're in the school uniform might be a bit of a giveaway. So let's enforce the laws we have about not serving drunk people and about not serving underage people. Support the people who, again, I think Jane mentioned a level playing field. There are people in the industry who do the right thing, but they're often pushed into doing the wrong thing because their competitors are pushing the bounds. Hold them to account. And then we also need to look at the issue of private supply of alcohol. Many young people drink in private settings, or alcohol is supplied by older siblings and older friends. And we need to address that as well. So it's not just about what happens in licensed premises, it's what happens in private settings as well. We need to address the trading hours. There's consistent evidence about that, and other people will talk more about this. But restrictions can reduce harm, and as I said, small restrictions going back from 5:30 to 3 a.m. makes a huge difference. And we need to, we've heard this evidence about tourism. Well, let's see the randomized controlled trials for the arguments. Let's have equivalence of evidence. I welcome that. Let's have equivalence of evidence. But let's not have an anecdote about tourism being used and accepted as evidence for liquor licensing. I defy you to go down to Northbridge at 3 a.m. and find many tourists. If we are going to have tourism, as has been said, as an equal player at the table, then let's ensure that this equivalence of evidence is demanded. Because the equivalence, the bar is set exceptionally high for alcohol-related harm and social impact. And we shouldn't have young people exposed to alcohol promotions. And there are issues that need to happen at the federal level, but local government and state government can take a strong lead on this. And there is enormous support for this in the community. It is not acceptable in this day and age that young people are exposed to alcohol promotions. And then we need to better understand and engage with the community so that they're more informed. This is where our campaigns might go, so that they understand the role of price and what we're talking about when we're talking of price, that the role that they might have as teachers, as schools, as universities, and the importance of control on promotion. And we also need to challenge this nonsense that it's just a small minority of people who are spoiling everybody else's fun. We all need to improve the way, the respect, I guess, that we give to alcohol. And finally, I've always been of a mind that if you grab people by their performance indicators, their hearts and minds follow. So we need to do some more, and that's where I think the government can also take a lead with the agencies that it has responsibility for. Thanks very much.
Very much for that, Steve Allsop. Now, we are getting quite a few questions coming through, so get them in nice and early. I will do my best to get through as many as I can. Steve, you went through there. You know what needs to be done. You have, for many, many years now, spoken about the kind of things, the kind of strategies that need to be put in place. And one of the questions coming through is, if we know what needs to be done to reduce alcohol-related harm, why have we failed to implement much of it, and what should we do? Are the barriers, as you talked about, dealing with different levels of government, local, state and federal, industry groups, lobby groups and all those vested interests?
I think it is all of that. And is the microphone on? You can hear me? Yeah. I think it is all of that. There was somebody, I can't remember who it was, in a study in the mid-1980s, did a study in the UK looking at how many government departments had an interest in alcohol. And it was 17 or 18, and the 18th most important was health. And the rest of them were treasury, finance, industry, foreign trade, and so on. So there is one, we've got to acknowledge that political issue. The other, if I can do this, I'm going to use the royal we, and Mark Twain said the only people who are allowed to use the royal we are the King of England, the Pope, and a man with a tapeworm. So if I offend you with the royal we, you can think of me as one of those. I think we in the public health side haven't done our job. We haven't brought the community on with us. And I think we need to do that. And I think there's a number of key differences, say, with tobacco, but we don't even sing from the same hymn sheet when we provide advice to government. And I think that there needs to be a clear voice. And I think we need to be much better at bringing the community on side. And Griffith Edwards, who was someone who I had a great deal of respect for, who worked in the alcohol and drug field, said prevention should be an invitation to change. And my understanding of what he meant by that was you actually have to bring people along with you. And I think we have to invest much more about communicating. And the illustration is, I think when we talk about price, a lot of people go, oh God, no, because they think we're talking about such huge price changes that it's going to have impact, on a huge impact on them. Whereas, as I said, even small changes, and I think we have to find a way of communicating better, in terms of the models that people have about what an alcohol problem is, in terms of what the effective strategies are, and sing much more clearly from the same hymn sheet as public health professionals.
If I can just pick up on that point, so where are the failures? If I can use the word failures, are we talking about the kind of campaigns, the kind of ads that we've been seeing on our TV, where it's the Saturday night, party goes crazy, people brawl, that's people's impression of binge drinking? Have we not been effective in the long-term concerns or the long-term health issues? Like where has it not been effective?
I think we haven't communicated very well. Now, I would say, and I think we also need to acknowledge good effort too. And I think West Australian government and people involved in the previous Drug and Alcohol Office and now the Mental Health Commission now have led the way in this country in terms of prevention effort on alcohol, and I think that's really important to acknowledge. And I think, a bit like not everybody was here this morning, but when Jane was talking this morning, we need to have champions and champions with support, because when you do stand up, it's a hell of an acrimonious and adversarial domain in which you stand up and speak about your concerns about alcohol. And we need leaders, and we need leaders who we support. And, one of those for me would be, we've a real opportunity here. Here's a minister who's also Deputy Premier. This is a unique opportunity, who's signalled his interest in this by having us here today. And, that is a fantastic investment and risk. But he's not just the 17th person at the table, he's also the Deputy Premier. And I think, we need to support and provide clear and support and evidence and communicate that in a way that's useful, and not have 25 different people whispering in ears saying 25 different things.
We have a question from Dr. Sudhakar Rao, well known to you all. He's obviously a trauma surgeon at Royal Perth Hospital, head of trauma unit there. He says the Royal Australian College of Surgeons supports a minimum floor price for alcohol to reduce the chronic burden of alcohol. Northern Territory is progressing this. Why not WA? Maybe that's a question better for the Health Minister.
Well, I think the Minister has indicated that, fantastic that the Northern Territory has gone down this path, and they've gone down this path because they just can't tolerate the level of burden in their communities with alcohol. Again, it's interesting that the Living with Alcohol programme in the Territory came about significantly because of Aboriginal women marching in the Northern Territory saying, we've had enough. And I think the community, giving voice to the community to say we've had enough. I think there's two other issues I want to make. One, Sudhakar, I'm assuming you're not here, you're watching, is that the Minister has flagged he's got an interest in this, and so I think it's important that he hears the various voices that are saying there's an evidence, there's a voice that's supporting you taking this action because availability matters. And the other is, whenever we speak about this, and I heard me referred to as this the other day, the anti-alcohol lobby. I drink. I used to run a bar. I'm not an anti-alcohol lobby. I want to see a massive reduction in alcohol-related harm for those who drink and for those who are affected by drinkers.
Would it set a precedent, though, having one state government go down that path? It's a pretty significant step. Do you expect that others would kind of fall into line?
I think it's a precedent, and I think it puts front and centre the importance that governments will place in the recognition that price and availability matter. And I think Northern Territory have gained the precedent position. They're a territory. So the state precedent position is still open, Minister. I think it's a precedent which is a good precedent for the rest of the country, and it also puts the pressure on the federal government to consider the importance of price in its deliberations, both as sensible tax policy and as effective public health policy.
Okay. A couple of other questions here. This one, Steve, meth and illicit drugs get lots of attention from media and politicians, more attention than alcohol. Is the attention proportionate to levels of use and harms?
Well, I never like comparing the two in that way. I think we can walk and chew gum, unlike not the current president, a previous president. I think we can walk and chew gum at the same time. And I think that, saying, well, alcohol, in terms of the number of problems in our community, and you'll hear a bit more about that later on, I think, the stats tell us, but if you're a mum being told that your son's only got the number 2 problem in the hit parade versus a number 1 problem, or a dad, I think that's not helpful. And at an individual level, sometimes people can have severe problems with another person can have a moderate problem with the other. So on the pure stats, the number of people who drink and the amount of harm in our community is significant. Often people who are heavily consuming one of the products are consuming others, and And my view is that we should not appear to minimise the harms that arise from methamphetamine. We need to do more in relation to methamphetamine, and we need to do a huge amount more in relation to alcohol. We're not even scratching the surface with alcohol. One illustration, in the evidence about that 18-year-old who died recently, and there was a coroner's investigation, she had 18 drinks. And then the Polish vodka that she had at the end, that was what got blamed, not the 18, 17 drinks she'd had before. And there was, the evidence given by the ambulance services was that there was one child just about every day, it was around about 300 children transported to the hospital because of alcohol problems. That's under 18. That's obscene. That's obscene in our community. So going back to your question, we must do more in relation to methamphetamine, but we must do a great deal more in relation to alcohol.
I can raise the issue of FASD because you haven't talked about that. There was a study out by Carol Bauer a couple of weeks ago. Now, she looked at 10 to 17-year-olds at Banksia Hill Detention Centre. She assessed 99 of those kids in there between May 2015 and December 2016. Now, 88 of those had one form of neurodevelopmental impairment. 36 had FASD. Now, that highlights certainly the vulnerability of young people, surely.
Yeah, and it's extraordinary. When we had the debate in terms of the NHMRC guidelines, which they're currently being reviewed, but when we had the debate and they first came out saying the safest option is not to drink, and the reason for that is there's mixed bits of evidence about very low levels of consumption, but where you can actually say it becomes a risk. And there was this debate going, we can't cause concern because we don't have clear evidence. And I said, if this was any other drug, what would we do? And we'd have the precautionary principle. We'd say the safest option is not to drink if you're pregnant. Simple. And there was huge debate about that. I got attacked by people, and how could I be so conservative? And it's extraordinary because nobody would debate if they had a 6-month-old baby giving them a drink. Now, it's about giving clear message, which is the safest option is not to drink, and the risk increases gradually as you drink more, and you don't have to go more than a couple of drinks to start getting into very high risk. Now, in answer to that, the main part of your question, FASD is a significant issue in our community. The costs, both currently and transgenerational, are enormous, and it's entirely preventable. Again, though, for me, if you look at the communities that have the highest rates of alcohol consumption, they're in our northwest, and those communities drink heavily, and alcohol is easily available, there's nothing else to do. The first thing you have to do is reduce alcohol availability in some of those communities. If that community drinks 3 times more than anywhere else, you're going to have higher rates of consumption and you're going to have higher rates of FASD. So it is about availability again. And then it is also about, not Wendy, not Ali G, Mary G. Sorry. I know your name, Wendy. But yeah.
And you look nothing like Mary G.
It's about really good campaigns. It's about medical professionals who give quality advice, and many medical professionals are confused about the advice that they give. They're confused. They say, a few drinks are okay, and then they go to the next medical professional and they get told, no, they shouldn't drink. And the same happens with alcohol. For anyone, having a few drinks is good for you. And, it's not medicine. It's a drug. It's a drug many of us enjoy, but don't pretend it's good for you. You can't sit on your settee and eat broccoli and drink red wine and live till you're as old as Mike Daub.
So wine o'clock is not a good thing.
Get off your bum and go for a walk and eat less fat. And there's this notion that's sold, and it's sold by a lot of our health professionals, that alcohol is good for you. And yet, if you look at the evidence, if you look at what the World Health Organization says, it says you shouldn't drink for health benefits. Drink for conviviality, drink because you enjoy the taste, but don't pretend it's medicine.
This is a question from a liquor industry employee who also says they are a non-drinker. It's dangerous to drive at 110 kilometres per hour, but we don't ban fast cars. We punish bad individuals. Why doesn't the health lobby focus on irresponsible individuals? How would you do that?
Well, firstly, I'd contradict, I get the point that's being made, but I'd contradict what's being said there. We actually do focus on individuals, but we also ensure that their cars are safe, that the roads are safe, we educate people, we police it, we enforce the law, and we enforce the law for all. And I haven't talked about banning anything. I've talked about maybe making sure that when we have discussions about availability, we look at the health and social impacts and probably pull things back a bit in terms of the number of outlets and the hours of sale, and that we give a high profile to health. So when we deal with car safety and road safety, safe roads, safe cars, train individuals, make sure people are well informed, and if people step over the line, and that includes the people who make the cars, as well as those who drive the cars, we hold them to account. So if somebody does something that's wrong, they should be held to account. Alcohol is not an excuse for violence. Nothing is an excuse for violence. I wouldn't see it as an excuse for violence. The individual who perpetrates violence should be held to account. But I'd also question if that person's been in a bar or a private setting where somebody else has constantly plied them with drink and then seen them out to their car, then they have some responsibility too. Of course the individual has responsibility. But the other side of it is not a philosophy debate. The practical evidence tells us that saying it's an individual's responsibility doesn't demonstrate to me any evidence that says that's going to make a difference to violence in our community. But reducing the hours of sale does. And again, reducing the hours of sale from 5:30 back to 3:30, 3 o'clock. It's not banning alcohol, it's not prohibitive.
But it's making it more difficult to access.
It reduces access, yes, for the benefit of everybody.
Here's an interesting one, if I can just find it. This question's just come through. Regarding Perth Festival and Fringe World equals mature enjoyment of alcohol. Oh, I've just lost it now. Could more focus on arts, culture, music and their funding promote better attitudes towards drinking?
Well, yeah, and this is the falsity of the arguments that we hear about a vibrant nighttime economy. Because if you go to Paris, the shoe shops are open till 12 o'clock, unfortunately for me. Not that I buy my shoes there, someone else I know does. I can't get in the house for them. The theatres are open. The restaurants are open. And it's a nighttime economy. But when we have debates about nighttime economy, it's about the bars being open till 3, 4, 5 in the morning, and the only people... And it's about when you come out at 11 or 12 o'clock at night, there's a diverse community on the street. There's people coming out of the restaurants, there's people coming out of the movies, there's people coming out of the Perth Festival. There's a diverse, vibrant community on the street. But when you come out at 5 in the morning, the only people on the street are pissed people like you trying to get a taxi with a kebab in their hand. Now, sorry to stereotype it like that, but it's not a nighttime economy. It's about more alcohol. So if we're serious about a nighttime economy, open the restaurants longer, open the theatres, open the museums, and have a diverse nighttime economy. But don't pretend it's a diverse nighttime economy when it's all about booze. And when you go to Europe, they have brilliant public transport systems that get people home. They also, in Scotland, I just used to open the windows and they'd all go home. And that was in the summer. We have a benign climate, so people hang around, can't get home. We don't get them home safely. We have drink driving laws that many people abide by, but then they can't get a taxi home, and then there's other people who are intoxicated bumping into them. So if we point to other examples around the world, and by the way, Los Angeles, which is not known for being a quiet, suburban, quiet place, they close at 2. And so let's not pretend it's about something when it's not. Opening longer, having more bars, won't turn us into Paris. What we need is a diverse, vibrant nighttime economy which has a diverse economic and which has people planning how we get people home safely, and closes at a time when we know the evidence tells us is probably a time when we can significantly reduce violence that affects all of us.
It isn't what you're saying different to the government's point of view, because they talk a lot about the European drinking culture that it wants to adopt here, and we have a couple of questions regarding that, and what is the role of tourism in liquor licensing, because what you're talking about there, Steve, does tap into this European culture that the government wants.
Well, again, in my presentation, I said that there's a myth about the European culture. They have very high rates of drinking, and they have very high rates of liver disease and acquired brain injury from alcohol. And in fact, France has brought in enormous controls on the availability and the promotion of alcohol because they were so concerned. Now, it's actually come down by a massive amount, but it's still I think it's 2.5 times higher than our rates of alcoholic cirrhosis. So don't pretend that Europe is a model. And the unfortunate thing is, I'm all for small bars, I'm all for tourism, but what happens is it gets added to the overall, and then it becomes more outlets and longer hours. So I think we shouldn't pretend that the European experience is, and in Paris I think they close at 2, but you can get an extension to 4, but you're then heavily policed, and if you have one breach, you lose your license for that extension. So again, you can't take one little bit of it out and say the rest of it will work here. So, and the other thing I think, and I had it in my slide, but I forgot to mention, I do strongly recommend this. We've seen the arguments about reducing red tape. Well, if we're serious about reducing red tape, reduce red tape for the community, because it is an adversarial, hard experience for the community to voice their concerns about what we do about alcohol. And you go in raising concerns and you're faced by a top silk who's being paid top dollar to argue your case down. So if we want to reduce red tape for the industry, well, reduce red tape for the community as well, to have their voice heard, help develop the capacity of the community to have their voice heard. And as I said, if we're going to have arguments about tourism being at the same table as public health, then let's ask for the same quality of evidence in the decision making.
And should they have a role in liquor licensing issues too then?
Well, it depends on, I think they have a voice, but it shouldn't be the predominant voice. And I think the predominant voice is the evidence, and well, the community and the evidence.
This question, we know from evidence direct intervention works. Why doesn't WA have a banned drinkers register and restrict access for criminal offenders? That would be pretty hard to police, I would imagine. You
can ask the Minister that. But again, the evidence about these sorts of strategies is it's very much focused on an individual. I've seen some examples of it. I've observed examples of it where I thought, well, that looks quite good. But in terms of impact across the whole population, the impact is very small. And again, it's the focus on the individual. It's saying you're solely responsible. A lot of people drink in private settings, so if we reduce the massive difference between off-sale and on-sale prices, that is a key issue for me, which is why minimum floor price is something that's really important to consider. Again, it's going back to not what we think might work, but what does the evidence tell us work, and what has the greatest impact for the lowest cost across the whole community. And it's not about singling out a few people who are doing the wrong thing. And I think you do have to have strategies to refuse people who are intoxicated and to be able to remove them from premises. But we also need to recognise that a lot of drinking is done in private settings, and we need strategies that address that too. And again, one of the key issues we haven't touched on, I guess, is sort of preloading. It's not new. People talk about it as a new phenomenon. I did it with really horrible 50-cent a bottle of wine. But the difference now is I used to do it for half an hour, and now people do it for 7 hours before they go out, and then they go out intoxicated. I wouldn't want to be running a hotel in that context. It's an enormous price difference between what you can buy and take away and drink large quantities of and then go into a nightclub or a hotel. So again, for me, that's one of the important aspects of why a minimum floor price could make a significant difference in our community.
All right, we will leave it there. Time is getting away from us. Thank you very much, Professor Steve Allsop. Please, thank you. And we'll get our panel for our next session to come up onto the stage in a couple of minutes. Georgia. Just in the nick of time. Thank you. Thank you very much. We'll get on to our next session. For this panel discussion, you will hear from each of our panellists. They'll talk for about 7 or 8 minutes, and then they will take questions from the floor, so keep them coming in nice and early. Today we have, kicking off things, Associate Professor Diana Egerton-Warburton. She's an emergency physician. She is also an Associate Professor in the School of Clinical Sciences at Monash University and the National Drug Research Institute here at Curtin University. She also sits on the Australian National Advisory Council on Alcohol and Drugs. She is also a local, born and bred in Western Australia, so it is good to have you here. You'll then hear from Professor Tanya Chikritzhs. I hope I've pronounced that correctly. She leads the Alcohol Policy Research Team at the National Drug Research Institute at Curtin University. We also have Miss Julia Stafford. She's the Executive Officer of the McCusker Centre for Action on Alcohol and Youth at Curtin University. And then you will hear from Terry Slevin, Cancer Council WA. We'll get Diana to kick off. Thank you.
Thank you. Wait for my slides to come up. Thumbs up. Thank you. I'd like to introduce you to my nephew, Robert. He lives in North Perth and he works in a suburban law firm. He and his wife, Sarah, they're not exactly what you'd call hipsters. They like to play board games and they're expecting their first child in June. This is Robert after a night out in Northbridge. He and Sarah were walking along James Street, not more than 200 metres from where we're meeting today. They were with a couple. They saw a heavily intoxicated patron leave a licensed venue. Intuitively, the group steered themselves across the road. The man followed. After telling Robert that he should shut his women up, he struck Robert in the jaw and cheek. Robert fell backwards and struck the curb. He lay there, lifeless and unconscious. Sarah thought he was dead. Police, paramedics, and what I can only describe is a wafer-thin slice of anatomical and physiological good luck. Robert woke up on the way to hospital. Emergency clinicians see these types of tragedies and near tragedies every day. We asked emergency clinicians about their experiences of alcohol-related violence. And 9 out of 10 of the doctors and nurses that sign up to work in our hospitals had experienced alcohol-related violence in the last year.
I cared for a woman who was about my own age. So her husband had been hit by a drunk driver and deceased on the scene. And she was unaware of this. She asked for him repeatedly, and I was there with her when they told her. So that was a particularly hard day at work.
In 2014, 2,002 emergency department doctors and nurses in Australia and New Zealand responded to a survey which asked them about their experiences of alcohol-related presentations in their ED.
I was obviously pregnant. An alcohol-affected patient threatened to punch me in the stomach
I was
in
assaulted
front of
and
his
knocked
wife and
unconscious
kids.
by an intoxicated patient.
They take
the
up a
patient was
huge amount of
arrested in the
resources,
ED.
especially the
We
trauma-related
had a
injuries,
patient who didn't
at a
tell us
massive
about his
cost
chest
to the
pain for
health
40
system.
minutes. because
If a
we were
patient is
dealing
in
with an
pain or
intoxicated
dying, the
patient.
last thing they need is yelling,
Other patients
abuse
have
and
longer
swearing
waiting
in the
times.
cubicle
They
next
can feel
door.
threatened and
Verbal
intimidated
abuse
by
is
the
an
environment
hourly
where they should
occurrence
feel
in my
safe.
ED.
You only
One
need
or two
one
people are
combative
removed for
alcohol-affected
physical
patient to
aggression
completely
each
disrupt the
shift.
functioning of the
Vomiting, abusing
department.
staff or other patients, creating a
fouling
scene
themselves
or
in the
generally
cubicle.
being
I've been
unsafe.
verbally threatened and physically assaulted, pushed, punched, spat on and bitten.
You have no idea what it is like at 2 o'clock in the morning to be telling the parents of a 22-year-old that their child is brain dead.
Dealing with intoxicated patients takes a toll on the staff. It's very tiring and emotionally draining.
Every day. And it's not just Friday night, Saturday night, it's every day.
Alcohol-related harm to our emergency departments has been underestimated by the current methods. We looked at 8 emergency departments around Australia and New Zealand 24/7. We screened over 8,000 patients, and for the first time we actually counted the people like Robert, the people that were innocent bystanders, because they don't come up in any data set. So we looked at the indirect harm, and what we found, shockingly, that was almost 9 out of 10, let me start that again. What we found that almost 10% of patients attending emergency departments around Australia were alcohol related, and this is higher than previous estimates. Dan Fadafich looked more closely at that same study at the WA cohort, and shockingly he found that 15% of ED attendances at Royal Perth Hospital throughout the week are alcohol related. That's 1 in 7. And 1 in 5 of those attendances were just like Robert, were innocent bystanders. Now, 2/3 of those presentations came from the Northbridge and the CBD area. These numbers, if you look at Australia, that equates to 500,000 attendances to our emergency departments every year. 500,000 preventable attendances to emergency departments around Australia. Now, unlike the GST, Western Australia sure gets its share of alcohol-related harm. It gets more than its fair share of alcohol-related harm. With our figures and our snapshot methodology, we would estimate that there are 100,000 attendances to West Australian emergency departments every year, 100,000 preventable attendances. Now, you can't stop this tab, but you can sure tighten it and reduce these number of tragedies that are presenting to our emergency departments, and I'm going to talk about some of the ways we can do that. Gordian Fuldy is a long-standing director of St Vincent's ED, and his research demonstrated that by instituting early closing in the Sydney central area, you can reduce these really serious assaults and injuries, these one-punch injuries, by 25%. In a study published only this week in the Medical Journal of Australia, he's shown a 10% reduction in orbital fractures from these assaults. Now, it doesn't sound like much, but it saved the healthcare system over $500,000 in 2 years. We know, and Steve talked about this, of the effect of Newcastle, but we now have compelling longitudinal and international data that demonstrates by early closing you can reduce these serious assaults and injuries. Those results, this is a very powerful study from Norway that demonstrated that policymakers can just turn on and off this alcohol-related harm by early closing. So for every hour after 1 a.m, you get a 10% increase, almost a 20% increase in alcohol-related trauma. So, and this, in Norway, they demonstrated the effect in either direction. Open the tap, an extra 20% per hour. Close the tap, reduce it. The same cities over the 10-year period. Jonathan Shepherd is a faciomaxillar surgeon from Cardiff in the UK. He was sick of seeing patients with horrific facial injuries like Robert's. His Last Drinks project is a highly cost-effective community-based introduction that could be introduced easily in jurisdictions across Western Australia. What it involves is sharing data that's currently collected by police, but also the big missing data, the health data. By asking people that attend your emergency departments, is this presentation alcohol related? And more importantly, where did you have your last drinks? And Dan Fadovich asked this data, and that's why we have the compelling data about Northbridge and the CBD area. This intervention of data sharing has allowed Jonathan to form local alcohol action groups. It's doctors, it's police, it's licensing, it's transport, it's local government. Together, they use their data to identify hotspots, and then they have local solutions for those hotspots. They may be licensing solutions where people get their licence restricted. They may be phased police interventions. There may be environmental solutions. ED clinicians go to the licensed venues and share stories and photographs to the people that sold the last drinks. It's a bit like the powerfulness of Robert's story. It works. One example of an environmental solution that a local council instituted was that there was an area outside a number of licensed venues that was clearly a hotspot, many people injured in that area. They couldn't pin it down to one venue, and when they looked at it, their solution was to turn that area into a pedestrian mall after 1 a.m. Stop the drunk punters bumping into each other, stop them going to prison, stop them going to hospital. This is the compelling data from Jonathan's work, and you can see where this was introduced in 2003. This is Cardiff, and this is like cities. A massive reduction in injuries and a very similar change and more powerful change to homicide. Where would you rather be? In Cardiff or in London? This intervention is highly cost effective, with savings of £85 for every pound spent on the intervention. It's now been taken up in more than 80 by more than 80% of emergency departments around the UK, and it's also been taken up internationally. So there are simple taps that policymakers can turn. Ensuring that there is early closing is such a simple intervention. If you ask, according to what Steve was saying, ask paramedics, police, emergency clinicians, what cosmopolitan things happen after 3 a.m, and you'll find that they don't see a lot of it. Collect data in your emergency departments on whether presentations are alcohol related, and importantly, collect the last drinks data. Share these with local alcohol action teams and effectively reduce ED presentations as well as assaults. Now, this is Rob and Sarah. This is Christmas, and they're reading a copy of Baby Love, which I gave them because they were pregnant at the time. And they've asked me to pass on a message saying that they're really hoping that some things will come out of this summit that will result in real changes. So when their son is 18, that they'll be able to walk down James Street and have a chance of being safer than Rob was. Thank you.
Thank you I'm just having a little iPad problem there. Thank you very much. Thank you very much for that, Diana. We'll now hear from Professor Tanya Chikritzhs. She leads the Alcohol Policy Research Team at the National Drug Research Institute at Curtin University, talking about alcohol availability and why price matters.
Thank you very much. I fear that you're going to be hearing similar themes over and over again. We all seem to be very much in concordance with each other, and I feel completely surplus to requirements as well after Steve's presentation, because he's covered just about everything there was to say about our alcohol availability. Anyway, I'm going to stick very closely to my script because we don't have much time. Here we are. Oh, that's not my fault. So, shall I just zoom forward to see if it's next?
Can you tap there?
Yes, I can. Well, I can start actually, because we don't need the slides for this. So I was just going to introduce you to alcohol availability, but you all know exactly what that is. So I'm just to recap, there's two main types. Well, actually, what is alcohol availability? Really, it's how easy can you get your hands on alcohol. Two types: physical, which means how close are you to the nearest outlet? You know, what's your age? Are you under 18? What are the trading hours of the local venue? And economic availability, which is really nifty, and that really relates to your disposable income as it relates to the price of your beverage that you're trying to purchase. And of course that's affected by, let's zoom forward now, discounting, tax, and, as we'll hear in a little bit more detail from me, minimum price. So why does availability matter? Well, it matters, frankly, because decades of scientific research evidence support the conclusion that as availability goes up, so does consumption and so do related problems. And in the reverse, as availability falls, use falls and problems decline. Now, there are levers, wonderful levers that policymakers and decision makers have at their disposal which aren't used often enough, as we heard from Steve. And I've only picked three because that's all I have time to talk about. And I've left off the 21, the older legal minimum drinking age, because as Steve says, it's a tough nut, that one. But the thing that gets raised a lot, particularly around liquor licensing matters, is outlet density, the placement and the number of outlets. But in truth, the relationship between outlet density and harm is much more complex than counting up numbers of outlets in an area. We really need to take into account the variability between outlets. A large discount store with huge discounting capacity, enormous numbers of brands, would have much greater influence on the purchasing habits of the local neighbourhood than, say, a small boutique bar that only sells wine. And it's also true to say, I think, that the alcohol research field, and myself included, we've overlooked and underestimated the contribution made by off-outlets. And Steve mentioned pre-drinking, and we have some evidence now that a lot of the harm that occurs at on-premises, like bars, pubs, nightclubs, is related to people who purchase cheap alcohol at an off-outlet and drank to intoxication before they even went out. So dealing with all of this variability requires modelling, and it requires the best data possible, and Diana talked about that. It requires data on the outlets themselves, sales data, and it requires the harm data, all to be linked together and stuck into lovely models. Trading hours. Some of the strongest evidence around restricting trading hours actually comes from Australia and Perth, and as you've seen, Newcastle as well. And basically they show, you've heard this, that when trading hours are longer, we get increased harms related to intoxication, like violence and drink driver road crashes. When you reduce those trading hours, we get fewer problems. But extended trading hours, not to be confused with lockouts, which are a different kettle of fish. And I think actually Diana has a new paper on that. I might be right, yes. But we're not going to cover that right now. Next, price, zooming along, is an extremely powerful lever. The evidence for price effects, there's over 130 papers around this. It mostly relates to taxation impacts, but we know that a 10% increase paid by consumers leads on average to a 5% reduction in consumption. Not just for, and it includes everybody. That includes heavy drinkers and young drinkers, problem drinkers, and what follows, of course, is a reduction in alcohol-related injuries and illnesses. Now, alcohol taxation is behind most of these studies, and it's a common means of adjusting price, but there is a new kid on the block, and we've talked about it. It can either be used as a standalone strategy or one that complements policies such as volumetric taxation. And by the way, volumetric taxation is not something we currently have in Australia, but this is clearly the domain of the feds and not something we can actually influence here at a discussion about state-based controls, but certainly something worth considering. But what I'm talking about is minimum pricing, MUP, we call it. A very hot topic. We've all heard about the Northern Territory looking to introduce a $1.30 minimum unit price soon. I'm not sure about the timeline. So what is MUP? Quite simply, it's where the government sets a minimum price below which alcohol cannot be sold at retail. The effect on the retail price of different beverages depends very much on where the floor price is set, but it always affects the cheapest beverages first, which is extremely handy from a public health point of view because these are the same beverages which attract the heaviest drinkers. So let's have a look at why that is. On the left here, we can see current prices. I just took these from various websites. And we can see that they're sort of arranged in increasing price per standard drink. Cask wine is at the bottom. Clean Skins is actually not much far ahead either in terms of price per unit, price per standard drink. We can see that if we introduced a $1.30 minimum unit price, the price of all these wine-based beverages would go up, but the beer and the spirits and the cider wouldn't be affected because they're already sitting at $1.30 on average per standard drink. On the other hand, if we chose to do $1.50, we then managed to include beer and spirits, but not nearly as much as cask wine, which would be going up by about 5 times the price. Of course, keep in mind that the reason why wine is such a great candidate for influencing with MUP is because it receives the wine, it's affected by the wine equalisation tax. It's treated much more kindly by the tax system than all the other beverages. And I suspect that if the federal government removed the wine equalisation tax tomorrow, this table would look very different. Right. So actually I've gotten ahead of myself. So why is MUP a good idea? Well, it's a good idea precisely because it increases the retail price of the cheapest beverages but leaves basically the others unaffected. So it actually has a very targeted action on the heaviest drinkers who prefer to spend less per standard drink, and it leaves the majority largely alone, small effects. But for the same reason it affects lower priced beverages, minimum unit price is often subject to the counter-argument that it penalises the poor. So let's take a look. I borrowed this figure from my colleagues at Sheffield University in the UK, where they've done some absolutely fantastic work modelling hypothetical MUPs on the UK population. And this one basically, shows us, what would happen. So the hypothetical is 45p, so a standard drink set at 45p, which I'm guessing is less than $1 Australian, maybe about 90 cents, right? And it's showing the extent to which different segments of the population, different levels of drinkers with different types of income, already purchase at below this minimum price, right? So we can see these green folks in here. These are the vast majority of us who drink at moderate levels. Very few of us actually purchase much at all that's under a minimum unit price of 45p. But by comparison, you can see that the harmful drinkers are purchasing very large quantities of their overall consumption under the minimum unit price. So these people, especially the ones in the low income column, are mostly affected by that minimum unit price. Now, clearly, there is something going on here in relation to income. Having said that, if you model what this reduction in consumption from minimum unit price would produce, the estimates are that these heavy drinkers in the lowest income area would drink up to 30 bottles of wine less a year. And the higher income heavy drinkers more like 3.5 bottles of wine because they can better absorb the price increase because they're on higher incomes. And even though this looks like an unfair approach which would affect the poor the most, the vast majority of the benefits of this MUP will actually accrue to this very group. So they actually receive 80% of the benefit of the reduction of deaths, hospitalisations and improvement in quality of life accrues to this very group. So it's not actually as regressive as some would argue. Recommendations. My recommendations, in a nutshell, use local level data to model effective evidence-based responses to liquor licensing matters. And as Steve said, give the community a better go at having a bash at being involved. It's pretty tough for communities to get involved in liquor licensing matters. Resist lengthening standard trading hours. Late trading permits really should be seen as a privilege rather than a right, and they should be shut down when problems occur. But to know that, you need to monitor. And introduce minimum unit pricing with regular adjustments for inflation. And I've added here that we should consider the feasibility of coupling that with a public health and safety charge. I'm not going to call it a levy or a tax because that's federal domain. But one of the problems with MUP is that the generation of the extra money spent doesn't actually accrue to the Treasury. It goes to the liquor industry. And it's not as much as you might think, but it would be nice to know that some of that windfall would be going back into treatment and prevention services. And one last thing I'll leave you with is that MUP is not necessarily a competitor or should be used in place of a volumetric tax. They actually complement each other beautifully. And if we could do both, if we get the feds to line up with the state, that would be fantastic. Thank you.
Thank you very much, Professor Tanya Chikritzhs. Getting the federal government and the state government to line up is wishful thinking, I think, on many issues, but who knows. Let's now hear from Julia Stafford. She's the Executive Officer of the McCusker Centre for Action on Alcohol and Youth at Curtin University.
Thank you. Well, for those working to prevent harms from alcohol among young people, reports of encouraging reductions in young people's drinking are welcome. Our challenge is to avoid complacency and to keep these trends moving in the right direction. The impacts of alcohol on WA children and young people continue to be of major concern. And these concerns centre on the many and varied harms young people experience from their own drinking and from the drinking of others. These include damage to the developing brain, the lasting impacts of fetal alcohol spectrum disorders, violence and family violence, injuries, drink driving and road crashes, and the list goes on. These are not problems without solutions, and many of the evidence-based approaches to reducing harms among young people will have positive flow-on effects across the community. And as we've heard today, a comprehensive approach is essential. There are no magic bullets. An important approach Tanya's just talked about is minimum pricing of alcohol. We know young people are particularly sensitive to the price of alcohol, and that changes in alcohol prices are related to changes in young people's drinking. Setting an appropriate floor price per standard drink will tackle the unreasonably cheap products and the heavy discounting we see from the big retailers. This policy should also ensure access to support services for those most affected. From the perspective of preventing harm from alcohol among young people, there is a strong basis to support a minimum price on alcohol in WA and to support action nationally to reform the alcohol tax system, particularly to remove and replace the wine equalisation tax. West Australian children continue to be exposed to masses of alcohol promotion in many forms. This is a problem. Systematic reviews of longitudinal studies show that exposure to alcohol advertising influences young people's beliefs and attitudes about drinking and increases the likelihood that they will start drinking or will drink more if they're already using alcohol. This is why the WA government's commitment to remove alcohol advertising from Transperth buses, bus stops and train stations is so important. We support action to implement this commitment in full and as soon as possible. To complement this nationally, it's time to end the charade of industry self-regulation under the ABAC scheme and other weak industry codes. For too long, the ABAC scheme has protected the alcohol industry from effective regulation rather than protected young people from exposure to alcohol ads. Try to argue that these alcohol ads don't target young women. If governments are serious about acting on FASD, acting to prevent FASD, governments need to get serious about regulating alcohol promotion. When a spirits ad telling you to party like it's payday can be placed outside a WA Perth Centrelink office without breaking any alcohol advertising rules, there's something seriously wrong with the rules. Legislated controls would also end the baffling loophole that allows commercial TV to show alcohol ads during sport in kids' weekend viewing times. In an effective system, regulation would be independent of commercial interests. It would start with a genuine motivation to protect children and young people and other vulnerable groups. It would cover all forms of alcohol marketing, and it would monitor compliance and penalise breaches. None of those things happen under the current system. By reducing the volume of competing marketing messages, harm reduction campaigns would also have greater cut-through. WA can be proud to be a national leader in alcohol public education campaigns. The Alcohol Think Again program is the only long-term, evidence-based program in Australia to raise awareness of the risks associated with alcohol and how to minimise your risks. The Alcohol Think Again campaigns support parents to reduce the risks of alcohol-related harm for their children. They raise awareness of the importance of no alcohol during pregnancy and the other low-risk drinking guidelines. They ensure culturally secure messages for Aboriginal families and communities, supported by the Strong Spirit, Strong Mind and Strong Spirit, Strong Future programs. And they build knowledge around the longer-term risks of drinking. Maintaining adequate investment in these comprehensive campaigns is essential to continue their positive impacts. The messages young people receive through schools are also really important. Well-supported alcohol and other drug education should be mandatory within the school curriculum. School staff should be supported to deliver comprehensive alcohol education with appropriate training, professional development and high-quality resources. Parents should be entitled to expect that their children will be provided with quality education which gives sufficient emphasis to alcohol issues. And to the issue of underage access to alcohol, WA's liquor laws very appropriately prohibit the sale or supply of alcohol to minors on licensed premises, but there is currently no effective means to monitor and enforce that part of the law. Voluntary retailer policies about asking for ID are not enough. We know many young people find it easy to buy alcohol. Police and other regulators need the appropriate tools to test compliance. Controlled purchase operations are one model. Trained underage volunteers visit licensed premises under police or other regulators' supervision and attempt to buy alcohol, following clear and strict guidelines. If they're successful in buying the alcohol, the accompanying police respond appropriately, particularly with a warning in the first instance. This type of monitoring can be used in Western Australia to monitor tobacco sales compliance, but currently not for alcohol. Community surveys show strong public support for this measure, and we hope that it will be seriously considered in the next stage of amendments to the Liquor Control Act. Thank you.
Thank you. Thank you very much to Julia Stafford. Our last speaker, Terry Slevin from the Cancer Council of WA.
Falling asleep, John Buggett, your Buggett, it's the end of the week. All very tired, so please stand up, stretch, wake up, big deep breath. Thank you very much for getting some water while I'm talking. Very good news. Now, I'm here to talk about the Australian alcohol, the drinking culture. That's the problem. That's what's causing all of this. The Australian drinking problem, the Australian drinking culture. That's our problem, it seems. Well, let's see if we can figure out what that really is about. I thought I'd find out what that actually means. I'm trying to figure out which button to push here, and I'll go with that one. And what's the font of all knowledge these days but Wikipedia? So Wikipedia tells me what the Australian drinking culture is, and it tells me that The Australian drinking culture involves alcohol for celebration, for social activities and for relaxation, but it's also an important revenue generator. It's also important for employment, and it's also important for export. So there's clearly an economic component to this game. But we also know that the Australian drinking culture involves drinking to get drunk. That's the objective. We've all heard it. But that results in 42 million incidents of binge drinking each year. I'm going to say that again. 42 million incidents of binge drinking each year in Australia. And what are the driving forces? Social customs, as I've already mentioned, habits, publicised images and normality. And how do we determine normality? It doesn't come out of the ground. It doesn't blow in on the sea breeze. It's not emanating from the Pindan, folks. This is carefully and deliberately generated. We've heard a lot of talk about the influence of availability. We've heard about pre-drinking, and we've heard about the fact that intoxication is not only common, but it's accepted and even encouraged. So if that's the Australian drinking culture, the fair question to ask is, how is it created? Before I answer that question, however, I'll simply point out, why do I care? I care certainly about the immediate adverse effects, because that affects my family, and my son's been attacked in Northbridge. But I also care about the long-term chronic effects. Only this week, Tanya's group released a bulletin articulating the long-term effects of alcohol consumption, therefore alcohol-related harm, and cancer is being amongst them. So 12,800 hospitalisations each year in Australia as a result of alcohol through the prism of cancer. 2,103 deaths, cancer deaths attributable to alcohol consumption. And recent data we've collected suggested that we're starting to get, as a result of the campaigns that have been run, that message through that there is a link between alcohol and cancer, and we were leading on that front, I'll let you know. But at the same time, the same survey tells me that 1/4 of our respondents think red wine prevents cancer. Another 50% either don't know or think there's no effect. So we've still got a way to go. So what creates this alcohol culture of ours? And when should we drink, for example? Simple question, when should we drink? Well, of course we should drink at the cricket, and good luck to the boys with 5 for 200 odd overnight in South Africa. But of course they're going to be wearing VB, and of course there's going to be a wine sponsor associated with it, and I suspect with their South African friends as well. And guess what? The Big Bash map tells us every team, but every alcohol brand that's linked with every team in the Big Bash. But also we should drink when we win the cricket. We should drink on Australia Day. Not just on Australia Day, on the entire long weekend. We should drink on Father's Day, we should drink on Mother's Day, we should drink on Valentine's Day, we should drink at the weekend when we're brewing up our skin cancers, we should be drinking at the beach. We should be drinking any time, and we should never refuse a drink. Is this drinking culture of ours something that comes out of the ground? No. It's deliberately, carefully, ruthlessly created by the people who sell the product. And guess what? You can drink on Friday, you can drink on the great Aussie Sickie, you can drink on payday, you should celebrate a win, any win, and you should drink anywhere. Gee, where does this Australian drinking culture come from? But hang on, alcohol, think again. So what are the solutions? The first one, you won't be surprised to hear me say, is about marketing. Firstly, marketing restrictions. Shall we take our foot off this accelerator? When we have a look at the figures and we see self-regulation, Julia made reference to our friends at ABAC. Self-regulation, the voluntary industry-run code that's meant to control alcohol marketing in this country, is little more than a joke. We have got the keys to the blood bank in the hands of Dracula, and we let it happen. We just let it happen. That is madness. Self-regulation, ladies and gentlemen, you won't be surprised to learn, in my view, is no regulation, and we've seen it play out time and time and time again. You want the evidence? Ask, we'll back up the truck. Secondly, counter-advertising. In this environment, this sea of marketing that we're all exposed to, that our kids are exposed to, yes, it's time we put on the brake a little bit. And it is worth recognising and acknowledging that the work of Tim's team at the Mental Health Commission with the Alcohol and Think Again and earlier iterations of that campaign is world leading, and I can give you the evidence of the effectiveness of it. People around the world look to that campaign. We need to make sure it's well supported in an ongoing way and persistent. This doesn't get fixed overnight. Second one, liquor licensing, and over the last fortnight in this state we've heard a lot of talk about this. But it's not unreasonable to simply point out that the laws codify and reflect and determine our culture. The rules set by our lawmakers are the ones that we allow to occur through our democratic process. And the recent relaxation of the Liquor Licensing Act in this state, and make no mistake, that's exactly what it is, there will be an increase in liquor licence holders in this state. There will be an increase in the number of places where people can buy alcohol. That means there'll be more people selling more product. For them to profit, for it to work in a business sense, guess what? They need to sell more booze. Does more outlets result in changing our culture? Does anybody genuinely believe that we will change our culture as a result of having more alcohol retailers available? I don't. But Roger, that ship has sailed. That decision has been made and it's been announced. The one thing that can be done at this point, the one thing as a voter I demand at this point, as we measure the effect of that, we want to know what's going to happen. Get the data. Find out what the current circumstances here are now. Let's find out what the impact is in 3 years, in 5 years, when you're still sitting at the cabinet table and the review comes up. Let's judge it on the effect. Let's get some evidence, let's get some proof, and have that as part of a legitimate policy debate. Human society has been debating the constrictions and controls on alcohol since time immemorial. There is evidence in Roman and Greek times of this public debate. Steve rightly articulated the benefits associated with alcohol consumption that societies enjoy. Those are right to be recognised. But there are rules, and every society forms rules as to how do we curb and control the harm. That means we have to persist in contributing to that debate, not turning a blind eye and allowing these changes to go through unquestioned and unchallenged. And the way we do it is not by telling stories, not by making up fairy tales, but by providing good evidence. Finally, we've heard about tax, and price matters a lot. Volumetric tax is without doubt the best tool in the Australian government. And this actually only came out yesterday. Peter Martin published in the Fairfax media. And there is some really fascinating data there. What he talks about is the Australian tax collection fell by 0.7% in the last period compared to the previous budget period. The total tax collection grew by 5.2%. The economy grew by 5.7%. Consumption of alcohol grew by 2.4%. Alcohol taxes shrunk as a share of GDP relative to the size of the economy in 2006-07. Without that shrinkage and the alcohol tax collected, the Australian budget would be $1.4 billion better off. This is a submission put into the Treasury in January of this year by a former Treasury official. New South Wales Audit Office put their costs of that state for government services for alcohol abuse at $1 billion a year, or $416 per household. The volumetric tax at a national level, Minister, is worth fighting for. And someone needs to step up and have that fight. Every tax review that Australia has ever done has said the alcohol tax system in this country is broken. That is without doubt the fact. Let's fix it. And finally, the one tool that's available at the state government level when it comes to pricing is the floor price. You've heard Tanya articulate the case. The recommendation of the Northern Territory was for $1.50. What they adopted was $1.30. I suspect it's a political process of what the government thinks it can get away with. Let's aim for $1.50 in Western Australia, because that's what the evidence says. And note, this is not a tax. This is more money going into the pocket of the retailers. This is not a tax. It's more money going into the pockets of the retailer. The industry benefits from this floor price. That's okay. I'll wear that as long as the community benefits and the evidence is there that they will. Thank you.
Thanks, Terry. Terry, I just want to very quickly pick up on a point you were talking there about our drinking culture, and I wonder how many people here have been to a party and watched somebody refuse a drink being offered to them and say, no, I don't drink, and they all get looked at like they've got about 4 heads.
Nadia, try dry July. Every single person in this room should go off alcohol for 1 month and have that social experiment for themselves. Absolutely opened up my eyes. Thank you very much, Marissa. And it's absolutely true. It's an extraordinary experience when you actually stop drinking and you find people feeling uncomfortable at the fact that you've refused a drink. And I think in many cases I read behind their eyes, what does that mean? Does that mean I'm having a drinking problem? It's a fascinating experiment.
But generally, I think those people are looking going, what's wrong with you? You don't want to drink?
Sure, and you get that feeling as well, but it's a really great experience to have.
Yeah. Look, thank you very much. Let's get to your questions, picking up on quite a few points that you have all raised, and I'll just get whoever wants to jump in on this one. Norway banned all alcohol advertising in the mid-1970s. Could we ever see such a move in Australia?
Sure, let's do it. Hey.
Well, there's a lot more that could be done than is currently being done to regulate alcohol marketing. And we talk about really seriously protecting young people from alcohol marketing. There is an enormous evidence base to support doing that. And so I think that's the strongest direction that we need to move in, take it out of the hands of industry and seriously protect young people. So
where would you start, though? Is it the TV ads during sport or kids, or the examples of where you actually place these ads in the community?
The regulations need to cut across all of those forms. What has happened is little bits of different codes tackle little bits of different types of advertising, and that's not working. We need an approach that cuts across all of the forms of marketing, even the ones that that advertisers haven't considered yet. You know, the world of advertising is changing constantly, and we need to get ahead of that rather than trying to play catch up.
So legislation?
Absolutely, legislation.
Okay.
And enforce legislation. And on that enforcement point, one of the debates we were having earlier in the week was the enforcement of the existing Liquor Licensing Act. I couldn't get data on the number of licensees who were prosecuted for selling alcohol to minors or to selling alcohol to intoxicated people. Why? Why is that not publicly available? And when it is enforced, my understanding is, I'm happy to be proven wrong, that the person who's charged is the drinker, not the seller. Who here has had children or themselves worked in hospitality? My hand is up, and I'm sure there are others in the room. Who here has heard that when they, as a result of responsible service of alcohol training, have suggested they should stop serving people who are intoxicated, and then been told by their manager, you keep serving because that's how we make our money? Real problem.
Okay. Diana, this is probably one for you. The ER data linking alcohol and assaults, do they relate to drunk patients or patients who have consumed any alcohol in a certain period?
It really it is the breadth of alcohol-related harm. So it's only a very small proportion of people that there are some incidentals, so have drunken alcohol, but it's unrelated. But that proportion is very small.
All right. There's a couple of questions. Darren, you're being very persistent, so I'm going to ask you a question. Thank you. Darren wants to know about, if you put in a minimum price for alcohol, is there any evidence to suggest that it would just drive that business online, that people would buy more alcohol online and somehow avoid paying extra?
Well, any alcohol sold in Australia retail would be subject to the minimum unit price rule. So buying it online wouldn't get you around it.
It wouldn't make any difference where else, if you were buying it from interstate or... Yeah.
Well, the whole I guess that's actually a point, I suppose, if you can buy it interstate. Yeah, well, we need some regulation around that. It's a tricky one.
I think with the bulk of alcohol, that any cartage costs would make that sort of, I think most wine sales are local.
Steve might be an expert in this, actually. You've got a wine cellar, haven't you, Steve?
Hospital bars.
South Australian wine, anyone?
What about the role for more intensive interventions and regulations in geographic hotspots for alcohol use and harm, like reducing takeaway alcohol sales? And we've certainly seen those battles in quite a few suburbs around Perth recently, where there has been a particular big liquor barn try to open up and there's 3 or 4, places within a K or two. What role at that local level is there?
I think it's really important that everyone, both the community has the power, and that Steve's comments about reducing the red tape for communities to have influence on these events. We know these liquor barns directly are associated with family violence and harm, and so we should be able to influence that. And part of this Last Drinks project that I was talking about is part of having liquor licensing involved. So recognising those hotspots and then coming up with a local solution for that. So that might be either licensed venues or take-out venues.
We've seen some really wonderful examples of community members and communities coming together to oppose some of these, particularly liquor retailers coming into communities that already have a lot of liquor outlets, and that's wonderful, and it's really great to see, but I don't think it's representative of the broader challenges that community members face in having a voice and being represented on liquor licensing issues. It is incredibly difficult. We find it hard as an NGO to participate, to get the right information and data that's local enough, that's specific enough to that the exact type of licence that they're trying to create. It is enormously difficult. It's legalistic. We get the lawyers of the applicants calling us up. We hear examples of lawyers of applicants calling up community members. It's intimidating, and they shouldn't have to go through those challenges, and most don't. I mean, it's hard enough to even find out that there's going to be that there's a licence application in your community, and there are barriers all along that process. And we really need the people. The government needs to look at all of those challenges that community members face and address them if we're really going to get proper community representation.
A quick observation, that is the reality of debates in relation to liquor licences are primarily within the industry. It's players within the industry objecting to new licensees coming in to cut their lunch. Essentially, it's a fight over a slice of the pie. So there's an enormous investment. There are specialist liquor licensing lawyers who act on behalf of one licence owner or a potentially new licence owner. So it's contested as a commercial debate. And in that fight, the community absolutely comes a very, very bad last.
So how do you get the community more involved? Because generally now it's at a local government level, isn't it? It's at their local councils where they'll oppose these kind of, another Dan Murphy's or whatever.
We need to look at the whole liquor licensing process. Local governments, councils have a role, but they have a limited role as well.
And that's usually where one of the few places the community can go.
Yes, and local governments, some are doing a great job. City of Belmont are really engaged in this at the moment, and it's great to see local governments having a voice, identifying when their community has enough alcohol and saying, seriously, let's not have another outlet. But they need to look across that whole liquor licensing process to what those barriers are and addressing them comprehensively. Don't leave it up to local governments. They've already got a lot to handle and they need to have a voice in this, but it shouldn't just be up to them.
And unfortunately, this government has just given a greater say to the tourism sector on those decisions. That's what's just happened.
Tanya?
Yeah, well, I was relating this back to the interest in minimum unit pricing, because this is, if it was something that was put across the whole state, obviously it would be, then it could, quite easily suck the wind out of the sails of a lot of these very large off-site liquor store types, which are, which local communities are very worried about. And it could be, we've seen plenty of examples. Actually, the Northern Territory really leads the way in that regard as well. Before the Northern Territory government decided on this minimum unit pricing, it was actually being done voluntarily in some parts of Alice Springs. at a low level. I think it was only $1, but it was a really good start, and it can be done. If they can do it in the Northern Territory, we can do it here, surely. But I just like, there's been some wonderful examples of where communities get behind a change when it's driven by a community and there's all the support in there. They can make enormous inroads into alcohol-related harm. We've seen it in communities that are extremely challenged by alcohol issues, and it can just turn things around. But having the backing of the community is very powerful when they get support.
This question, there's an acronym now. AOD prevention is fragmented in WA. It is often misunderstood and ad hoc. Time for that comprehensive approach to be developed. How should this be done? What does AOD stand for?
Alcohol and other drugs.
Thank you.
Well, a part of the answer is part of a discussion I was having at morning tea, and that is we've just heard the Sustainable Health Review interim report come down, and it talks about the fact that the health budget is represented 2.7% being invested in prevention. And I was tweaking a few tales about the extent to which we could actually address that. Some of those additional investments in prevention can help to address these problems. For us to pretend that we can do these things on the smell of an oily rag or hope that it comes out of the spare time of members of the community is simply unrealistic. I am in absolute awe of people who have the energy and time to devote in these kind of community campaigns. But some resources at a local government level, at even area health service level, to allow people to get guidance as to how they can mount their complaints and the kind of process they need to deal with. Some assistance to do those kind of things takes resources. And it seems to me that's a legitimate investment for an expansion in the investment in prevention to allow these kind of decisions to be made through the prism of health.
All right, let's move on to this question here. Really interesting about bringing parents and carers into this equation. Now, lots of proposed strategies we're hearing today, but what about someone else doing it to us? What about with us? What role parents and carers?
I think that kind of goes back to the discussion we're having about giving people a chance to actually have a say and helping them, giving them tools to do that. I was involved in, a long time ago, a little thing called the Alcohol Advisory Council, and we tried to develop a toolkit for people who actually wanted to take some action and have some influence on these kind of liquor licensing decisions. But as Julia rightly pointed out, how do you know if there's going to be a new liquor store applied for around your quarter? How do you find that out? How do you get access to that information? And if you do and you don't like it and you talk to your neighbours and you think it's going to result in more alcohol-related harm in your backyard, what power do you have? So there are things that have been done in the past, but far too under-resourced to help people in those kind of circumstances to respond. I'm not quite sure if that's an answer to that person's question, but when it comes to parental involvement, anybody who's had kids has absolute knot in their guts about how their kids are going to deal with growing up in this society when it comes to alcohol.
Diana, the people you see and you treat, I wonder, parents, what's the reaction when they come into the ED and their child has injured themselves through excessive drinking? Are they actually aware of their child's drinking habits? How do they react, and how much do they know about what their kids are doing?
I think the responsible serving of alcohol, which is now in all jurisdictions around Australia, is really important to educate parents about, because often we have parents bring in children and adolescents who have been at a party and they've been supervised by an adult, and they don't actually know that they have actually broken the law by serving these children or adolescents alcohol, and the huge impact it can have. So I think that more awareness around parental responsibility is really, really important. And I think part of the other thing that the College for Emergency Medicine has called for is screening and brief intervention in emergency departments for people that present with risky drinking. And a group that's really important to screen is the adolescents, to determine what their level of drinking and other drug use is. And it's a real opportunity to intervene. We've done some research around the idea of the teachable moment, and if the young person can relate the drinking to why they presented, it's a very powerful opportunity to intervene. But really, ED clinicians at the moment are swamped by acute care responsibilities, so trying to introduce these brief interventions without additional resources is hard.
I'd just like to add, it's a really good point you make, Diana, about secondary supply legislation and the importance of people being aware of that, and the idea that, you know, mums and dads supervising children's parties, and I've supervised one myself in the not too recent past with 60 13-year-olds, which is quite a challenge, is you know, doing the right thing, being aware of your requirements under the law now, but also, if I can be a little bit more ruthless about it, teach by example. So, you know, the kids are watching you. What are you doing at the party? Are you standing around supervising drinking? Almost likely, highly likely, I'd suggest. And the kids see you. It's really one of the most protective things you can do as a parent is actually, at least if there are two of you, have one of you who's close to being a non-drinker. So you're setting an example that you don't need to have alcohol at every situation, at every meeting, at every party, at every joining, every time the friends come over.
I think another area that's really important is schools and school functions. And there are a lot of schools that have alcohol served at school functions and fundraisers related to alcohol. And I think that's an opportunity for government to intervene. In the similar, you know, you shouldn't have it being advertised on your buses and you shouldn't have it served at school functions.
School ball is an extraordinary cultural experience. Everybody who's had a kid finishing high school has gone through the school ball experience and the debates as to whether alcohol should be a part of it. I, at my son's school, had to simply say, it's kind of against the law. Actually, it's not kind of, it's against the law for 17-year-olds to be drinking. Now we've got a situation where there's some 17, some 18, still mostly underage, but I still hear people talk about that debate, and it is an absolute cultural touch point that why are we reluctant to say the law says you can't drink at 18, so you're not 18, so you're not allowed to drink. It has to be as simple as that, but it's still an argument. That tells us something.
There'll always be a parent that'll put their hand up and say, yep, pre-ball party at my house and after ball party at mine where there will be alcohol.
Exactly.
And you mentioned schools, and that would probably be not hard to control, have those regulations in place, no alcohol, but it's the junior sporting community as well. And, you know, I've got to say, you know, when my son was playing Friday night cricket, every mum rocked up with a bottle of champagne and some nibblies, and that became a weekly social event, and that is a harder thing to control, and the message probably even stronger there, isn't it?
It's a theme for future Alcohol Think Again campaigns. And it is an illustration of the kind of challenges we face. These are cultural things, and we've got to push back on that extraordinary array of opportunities that the industry presents to us as the norm for drinking.
So what do you do? Ban alcohol being brought to these, you know, sporting events?
You be brave about having these conversations. You run campaigns that are risky, that risk heads of agencies getting complaint phone calls. You run campaigns that risk ministers getting complaint phone calls because you're running too hard, but you create a debate in the community that allows people to actually express the view, because often the person who wants the responsible thing doesn't want to feel like the wowser, doesn't want to feel like the person who's being hard-nosed. But if you create a public debate on that front, that's where communities shift, small steps at a time. Absolutely ruthless persistence is essential, but good evidence and taking risks with your campaigns.
I've got time for one more quick question, and an interesting one. How do we help newly arrived Australian communities with little or no contact with alcohol deal with their children's drinking, people like Muslims, Buddhists, Orthodox Christians?
I think it's a really interesting question, and it's not something I know a lot about, but I think perhaps we need to talk a bit more with the groups who work directly with people who've arrived in Australia and check what information they are or could be providing. And, we have the great information through the Alcohol Think Again program. There's great information for parents about young people and alcohol. So perhaps there's opportunities there, but I need to find out what's happening.
I would also be reversing this, because I think it's really what you're talking about in terms of changing Australia's culture around its relationship with alcohol. So we did one of our national snapshots on Australia Day to highlight the issues of the cultural relationship between alcohol and Australia Day and what it means to be an Australian. It shouldn't mean, it shouldn't be our national day of going out, getting drunk, injuring yourself and someone else and ending up in the emergency department.
Can I very quickly point out that it should be said today, and it's really important for it to be said today, amongst communities within Australia, Aboriginal population in Australia have a much higher proportion of non-drinkers than most other communities in Australia. And yet it's far too often we see a depiction of alcohol-related problems being sheeted home to the Aboriginal population. It is wrong, it is unfair, and it's a disgrace. So supporting people like Aboriginal communities who fight for having alcohol-free communities or places where they can safely operate in the absence of alcohol is a really fundamental human right we should fight for.
Thank you. Thank you, and thank you very much to our panel. We have come to the end of this session. Please thank Associate Professor Diana Egerton-Warburton, Professor Tanya Chikritzhs, Julia Stafford and Terry Slevin. And we will now call on Professor Jonathan Carapetis, Director of the Telethon Kids Institute, to sum up the main themes of today.
Is this on? Yes. To quote Terry, I'm burgered, you're burgered, so we're going to all want to burger off. So I'm going to try and keep this very brief, because I think we've heard incredible consistency today in the messages, both in the first and the second session. And I'm just going to kind of briefly whip over some of those themes and then kind of get to some, if you like, conclusion. Obviously, we began with the Minister issuing us a challenge about what we can do. And I think we've all thought about that, and lots of discussions come up, but I think, Minister, it's also fair enough to say about how can we support what you want to do, and I'll come back to that at the end. So Barry gave us a really useful overview of both the data on alcohol and obesity, and really cut to the importance of data itself. And I think that's something that came through in a number of the speakers, and really a critical point is that we need to base what we're going to do on high quality data, on high quality evidence, and we need to have evidence about how it's working. And that's really, that really cut through a lot of the discussions. Barry also highlighted the importance of understanding that investing in health is a cost saving, that we need to, if you like, change the debate around whether health is a cost or an investment. And the data that came through that he presented really identified some particular high-risk groups and communities. And I think some of these discussions came through in subsequent presentations, but perhaps not enough. So both with obesity and also with alcohol concerns, the three particular populations that were pointed to be at high risk were Aboriginal populations, those not living in the metropolitan areas, and also low socioeconomic groups. And I don't think we really necessarily got through to those points, and I'll come back to that. Jane, of course, gave us the kind of how-to about obesity, and really identified a number of major interventions that we could focus on, gave us the idea that we need to firstly have a policy on obesity, that there is a clear list of things to be done that include things like marketing, particularly the use of billboards, advertising on state property. These are things that could be done, and she really highlighted some things that within the West Australian context are relatively easy. Kilojoule labelling, the implications of planning laws, and that's that burger off concept. How do we enable both the adjustment of planning laws and then enable local governments to implement them appropriately, responding to what communities want? But she also identified a number of challenges that I don't think we have a clear solution to in the absence of a national approach around sports marketing, around how the industries regulate, and this whole concept that again came through in the alcohol discussion, that self-regulation is no regulation. That there are problems with the health star rating. It's a great thing overall, that it needs to be refined. And someone pointed out to me, if you go to Coles, you buy a packet of cornflakes and it's got 3.5 stars. You buy a pack of whole unroasted macadamias, which is a reasonably healthy food, it gets 1 star. So we've got some work to be done on that. And if you go to the traffic light system at canteens, that sweetened milk drinks get a green light, as do juices. So there's a bit of work to be done there. The other thing that really I think Jane identified is, why is it so slow to get things done? And this comes through to the Margaret Chan quote, which I thought was wonderful. It's all about big food, big soda, big alcohol. And that's if you look at all the stumbling blocks, both in the obesity and the alcohol discussion, it's not about whether or not there's community support, it's about what the obstructions are from the commercial interests. It's all about vested interests, and I think it came through loud and clear that the community really wants to see things change. And so that's really, I guess, Minister, I'll come back to this, but there's no concern, I don't think, that you should have around whether or not there's going to be popular support for being bold and doing something significant, because both in the obesity issue and in the alcohol issue, the public support is kind of like where we got to with tobacco, that everyone realised that they want something done about it. We also talked about obesity as the new normal, and that's a big issue. And we did still come back to this whole issue about, where we're going to spend our dollars, and should we spend our budget on prevention? And again, that comes back to my concern as to whether we're using the right language, because it's not a spend on prevention, it's an investment in a net cost-saving and economic building issue. We got through the panel in the morning session. Maurice identified the need for a comprehensive approach, which I think we very much heard that. We heard the message about local government being here to work with us. Wendy really gave a wonderful presentation around the issues of obesity in Indigenous communities. I loved her quote around, well, the statement I wrote down, which was that we need to look at obesity through the lens of environmental and social determinants and the accumulated effects of history. And I also love the idea of having a champion in putting Mary G on a diet. I thought that was a great thing we should do. And the other comment I loved was that when we look at the social determinants, it's often seen to be through a negative light. We should be looking through the cultural determinants, which is really a strength-based approach. There were a number of things that weren't touched on, and that's because inevitably in a day like this, you can't do everything. So some things that struck me that perhaps we could have spent a bit more time on if we had the time were the issue of portion sizes. And that comment that I think Jane mentioned around that I'd noticed that, when I was a kid, plates were this big, and then now they're this big. Back then, they got this big thanks to, I think it was Nouvelle Cuisine. You get this big plate with a little bit of food in it. The plates haven't changed, but the food now fills the plate. And so what's the opportunity to, whether it's through regulation, through working with manufacturers or through health promotion, look at the issue of portion sizes. We didn't talk enough, I don't think, about physical activity. We talked a bit, but we didn't talk enough about it. And I noticed, for example, I think Perth is a fantastic cycling culture. I think it's wonderful, but it's a sports cycling culture. And you look at the picture of Bogota, I think it was shown, everybody was there just cycling to work or to school on their little treadly. And that's perhaps something we also need to think about in this town. It's not just about getting in your Lycra and going at a gazillion miles an hour. It's also about how do we encourage people to just get to work and get to school and back. The built environment, again, got some attention, but not enough attention, because we know that there's a lot that can be done in the built environment to improve walkability, to improve the mix of the types of developments we have, so that we don't have the mall and the industrial section. We know that if you have mixes of developments in together, that is associated with much better physical activity and that people have a much better lifestyle. And in the obesity bit, what's the role of the health system? Again, I don't think we really focused on that enough. We talked about the importance of hospitals and fast food joints and sweetened beverage sales, and that's really important. But we don't talk enough about the role of the medical people, the health people themselves. And we know from the tobacco discussions that it's the role of a doctor or another health practitioner talking to someone about smoking and talking to someone about their diet actually has a very significant impact, and we don't train that enough and I certainly got very little training myself around lifestyle nutrition, for example. So I'll come back to the final comments, but just to move on to the afternoon session, I think we really, through Steve's presentation, got the recipe again, and it was really reinforced. It's about availability, and Tanya really highlighted nicely that there's two types of availability: physical availability, ease of access, proximity, legal age for drinking, and economic availability. And Minister, I don't think you're going to find anyone here who doesn't think you should introduce a floor price tomorrow. So go for it. Then we talked about the other things that could be done. And again, Steve highlighted the importance of data. And I think we also heard that from Terry, that whatever we do, we're going to have the data. Even if it's a policy that we're not so convinced about, we want the data to see whether it's working. So availability, minimum legal age, trading hours restrictions, and it strikes me that none of this is actually that the majority of the population is going to oppose. It's opposed by various industry sectors, but we're not talking about changing people's lifestyles on the whole. Advertising, engaging the community, having some KPIs, all of those things are important. What I think is also critical here is that, and we talked about this with the obesity, we need to be singing from that same hymn sheet. So that's what I loved about the afternoon session, is there was a set number of things that kept coming up, and there wasn't contradiction. So I think we've got a pretty good message to sell. And there was also this discussion around local hotspots, if you like, local groups, and how we can empower local communities to take control. If I could identify a couple of gaps, I think, in the discussion this afternoon that we'd like to spend more time on, I think that issue of alcohol in Aboriginal communities didn't get enough attention. Terry, thank you for raising it at the end. But I think it's also, as much as it's unfair to paint alcohol as an Aboriginal issue, and I couldn't agree more, I think it's also important to recognise that alcohol is doing a lot of damage in Aboriginal communities, and that there are places that are really stepping up and trying to do something about that. How do we deal with that? And that also comes into the other big gap, which was we didn't really discuss. I think most of the discussions around alcohol seemed to me to be a very metropolitan discussion. We didn't really talk about alcohol in regional centres. And it comes back to my discussion in the morning. If we want to deal with alcohol in some of the Pilbara towns, particularly those that have a significant mining community as well as a significant Aboriginal community, then how do we really empower that discussion? How do we control the vested interests? And how do we potentially look at some really the hard things, which is like the sort of regulations that Fitzroy Valley brought in and that Halls Creek brought in? How do you do that in a place like Port Hedland or Karratha? So I think those are areas that we need to tackle. But to come back to the critical issue, I think there's a small number of things that could be done pretty quickly that you will get remarkable support for. And so the final comments I guess I want to say to you, Minister, is that we feel like there's a bit of a momentum here that you've really started, and so congratulations to you. You've got to make things a priority. I think you've identified that there are two things that are of interest to you: obesity and alcohol. That needs to be followed up. We're here to support you, but if you really want to do something about it, you have to make it very clear that these are priorities for you and for this current government. That I believe in both of those issues, the community is taking the lead, and now it's up to government to catch up to what the community actually wants. And we need to learn from what happened with tobacco, that you just have to be tough and take on the industries because the community wants something done. That we need comprehensive approaches. We need to get in early, particularly getting those kids before they start drinking, before they start on their patterns of poor nutrition and poor physical activity. And I went through that list of things that we recommended this morning and this afternoon, and I couldn't find anything that's actually that expensive. And I know that when you talk to your treasurer, he's going to say, well, don't come to me with anything that's going to cost any money. Well, I think most of this doesn't actually cost money, and some of it gives you a bit more money in your coffers, and some of it saves money in the long, well, it all saves money in the long term. So I think in the Sustainable Health Review, we have an excellent template to do something significant, to build on the already great work that's happening in the departments, in the community right now. We've heard some fantastic things that are happening in Western Australia. And I personally, and I suspect this room would urge you, Minister, to be bold, to be willing to step up and say, no matter what anyone else is doing, we're going to take this seriously. And you will find that everyone in this room, and I suspect the majority of the people that we can bring on board, will be behind you. So go for it. Thank you.
Thank you, Jonathan. Fantastic summary. If I could invite the Minister to offer some final remarks.
It's a comprehensive list of things to do. Thank you very much, Griff. Thank you very much for that summary, Jonathan. I think it was incredibly comprehensive and really did capture the spirit and the detail of the day. I am constantly impressed by the passion, by the academic rigour, and by the work which is done by many of the speakers here today. So my earliest experiences were sitting down with many of you who are in the room today, you in particular, Maurice, and listening about the arguments around public health and the importance that they play in terms of the lives of the community that we represent. I was, when we raised the issue of the Preventive Health Summit and the idea of the minimum floor price, I was expecting a range of reactions to the proposal. I was pleasantly surprised by the reaction to the community. No one, I got very few people writing to me or making comments to me about a minimum floor price being a bad thing. There was a few pensioners that wrote to me saying that will impact on their capacity to have a tipple. Most of the reactions that came through were, I guess, from people inside government, nervous about what the response would be and concerned about the pushback in relation to this stuff. Some of the things which people said today really impacted on me, though, in terms of what we now need to do to push the debate forward. In particular, Diane's comments around data, and that was reflected in a number of the presentations. It's important that we now utilise the capacity we have to aggregate data and in particular focus the data and the capacity it has to really point the finger and direct to the policy hand. That seems to me to be an incredibly important aspect of what we're doing here. In addition to that, I think particularly in the obesity session and in the alcohol session, I think there's some pretty low-hanging fruit. And a couple of times I found myself nudging the Director General saying, well, that's pretty easy. We can get on with that. So there'll be some things coming directly out of today's discussion, which will see some changes made. I can assure you of that. In addition to that, look, I think Terry's contribution around where does this culture come from really impressed upon me just how much big alcohol, big soda, and big sugar, for want of a better description, has impacts upon this debate. Have any of you seen the program, by the way? I'm not quite sure why Terry sent his dad along today, but if you look at the photo of Terry in the program, there's this bloke, I think he's just sitting around about the age of 25. I'm not quite sure where he dug that photo up. But I mean, clearly, it basically sets a very clear agenda and a very clear indication of where we have to put the work in. Look, I need your help. Everyone, I need your help. I remember as a young man, because my dad was a GP at the time, I remember the tobacco debates. I remember how comprehensive they were. I remember how much they engaged the whole community. I remember the esprit de corps and the excitement I felt when I saw the Bugger Up campaigns when they used to chop down billboards along Stirling Highway that featured tobacco advertising. I remember the vibrancy of that debate. I remember the anger, and I remember the the great victories of that as we've made some solid gains in relation to tobacco law reform. And those sort of debates and those sort of campaigns will be needed into the future if we're going to continue to make Western Australia a healthier community. Can I just thank you all very much for attending today. Thank you, not only the people in the room, but those who are still persevering online. Thank you very much, everyone, for your thoughts, your attention, and for your ongoing support in making a healthier Western Australia. Thank you.
Thank you for those final words. I think it's really worth taking a moment to thank the Minister and the Deputy Premier for his leadership on this, for convening this summit. Efforts like this do require leadership and they also require courage, so thank you for calling everyone together and giving us an opportunity to begin this conversation. And of course, thank you to all of you for coming and to our speakers. We've certainly had a vibrant day, and I'm sure there's lots more that's going to carry on from today into our workplaces and our discussions. We spoke at the beginning about this being a conversation that's going to continue. One of the ways that you can continue the conversation is to be a part of the giving feedback, on the Government Sustainable Health Review interim report, which you can find on the government's website, and by going along to one of the review panel's public consultations. Also in our own lives, just an encouragement to everyone to remember to bring this issue out into our forums, into our areas of influence. And hey, we've got a long weekend ahead of us. We've got an opportunity to express our Australian culture in one of many ways. I think we've had a provocation today to look more to the fact that it's going to be a gentle easterly on the Monday long weekend. Have a healthy, active Australian long weekend. Ladies and gentlemen, thank you very much, and I hope to see you all soon.